The PRECIS-2 tool was designed to help trialists when they're designing their trials. So Schwartz and Lelouch in 1967 make the point that although a lot of trials ought to be designed as pragmatic trials, in fact trialists naturally veer towards designing them as explanatory trials when pragmatic trials will be a lot more appropriate. So the PRECIS-2 tool was designed to help those who are designing trials think about designing their trial as a pragmatic trial. So it has 9 domains: eligibility, recruitment, setting, organisation, flexibility of delivery, flexibility of adherence, follow-up, primary outcome and primary analysis. And those 9 domains together kind of cover different elements of a trial that are handled differently if you're thinking about an explanatory trial or a pragmatic trial. So the way that the tool works is that you take each of those domains and you score them from 1 to 5. 1 meaning it's handled in a very explanatory way, and 5 meaning it's handled in a very pragmatic way. And those scores are then plotted on a wheel. And from what the wheel shows, you can tell whether your trial is very pragmatic, very explanatory, or somewhere in between. So I've got 2 wheels, which I'll just show you to give you an idea. The first wheel is for the REVA-2 trial. That was a trial of rapid HIV testing done in UK primary care. And this was a cluster randomized trial. And actually you can see from the wheel that for most of the domains, in fact for all of the domains, the trial scored a 4 or a 5. So you get this nice big wheel of a pragmatic trial. The next wheel is slightly different. This is for the weight trial. Now the weight trial was a trial of Montelukast for children with who might wheeze, and it was done on preschool children. And the way the trial was set up was the Montelukast was given to parents, and they were told to administer the Montelukast when the children had certain symptoms. So some of the parents were given the Montelukast and others were given placebo. They didn't know whether they had Montelukast or placebo. Now you'll see in this wheel there are 2 particular spokes or 2 particular domains which have scored nearer to the explanatory end of the scale, and they are recruitment and follow-up. And the reason why they've scored nearer to the explanatory end is that, say, for the recruitment, this was a very large trial and we needed to get enough participants into the trial. So they weren't only recruited in the setting where the intervention might be used if it was rolled out, but they were recruited from other settings. So that makes it a little less pragmatic than it would be otherwise. And the follow-up was also less pragmatic because in this trial, for safety reasons and other reasons, the parents were followed up frequently by telephone call, and then also required to fill in a diary of their children's respiratory health. Now that wouldn't happen in real life, but it was very useful information for the trial, but it made the trial a little less pragmatic in that aspect.